if you're watching this video, it means that you are getting close to going home. We know that you have many questions about going home. Now, we know that you've recently undergone some procedure on your chest. You have either had a thoracoscopy, where you have 3 small incisions and have either lung or esophageal surgery, or you've undergone a thoracotomy, where you have a larger incision and have undergone lung or esophageal surgery. During this video, I will distinguish between the two if there is a difference. Otherwise, the majority of the instructions will go for both surgeries. This videotape can be viewed several times while you're in the hospital, watched by your family. We will also put this on our website and give you our website address if you have access to the internet. You will also be giving these instructions in a form on a sheet so that you can read them once you go home as well. We will provide you with your nurse's phone numbers, so if you have any questions or concerns once you go home, you can call them. After hours, you will be given an emergency number. One of us nurses is always available to answer any questions or concerns once you go home. When you go home, we want you to be up and active. We want you to walk several times a day. The more you're up, the more you're active, the better you're going to feel. Initially, you may have some shortness of breath when you're walking, and that's due to the amount of lung tissue that we have removed. This shortness of breath will get better as you do more and more of your walking activities. We also encourage you to take home your incentive spirometer if you have been given one. Do plenty of coughing and deep breathing at home so that if you would develop a pneumonia, we will help you prevent that by using the incentive spirometer. Remember, you have chest incisions, so do not do any heavy lifting with that arm. If you have the small incisions, give yourself about 2 weeks for that area to heal. If you've had the larger incision, it may take more like 4 to 6 weeks before you can do any heavy lifting. It's not that you will actually hurt your incision, but it will cause pain if you do any heavy lifting heavier than 10 pounds. You may return to work within 1 to 2 weeks after having the small surgery. If you've had the larger incision, you may have to be off work longer, say 4 to 6 weeks. That will be individualized. If you need any kind of assistance to return to work, please contact your physician's nurse. You can start to drive within 1 to 2 weeks after having the small incision, as long as you're not taking pain medication. Pain medication will alter your ability to make judgments, so we encourage you not to do any driving. If you've had the larger thoracotomy incision, you may need more time before you start driving, as it will be uncomfortable for you to turn the wheel. You may go home and shower 2 days after your chest tube has been removed. You will have a dressing over that area. Please take that dressing off, take a shower, wash your incisions with soap and water. From that chest tube site, you may notice a little bit of a pink drainage coming from that area. And that is normal. It's just what was left that the chest tube did not remove after your surgery. You may need a small Band-Aid or a dressing over that area for a few days. Just wash your incisions with soap and water on a daily basis. There's no sutures to be removed. The steri-strips will fall off on their own. You will have some pain after you go home. Please take the pain medications that have been provided for you. If you've had the little thoracoscopy surgery, your pain will probably get better within the first 1 to 2 weeks after you go home. The thoracotomy incision does provide pain that will last up to 3 to 4 weeks after surgery. You may need the pain medication that long. If the pain medication that you're taking is too strong, you may even switch to extra strength Tylenol to help with that pain. Also, because we've gone through your ribs and we've irritated the nerves along your ribs, you may notice pain in the front part of your chest. You may also notice some numbness. This is all normal surgical pain. If you take your finger and put it on one of the incisions and track it along the ribs toward the front, you will see it's because we have irritated that nerve. Some people who can take over-the-counter ibuprofen, I would recommend that, as it does help alleviate some of that inflammation in that area. If you've had any problems with ulcers, do not try any ibuprofen. After you go home, also, the narcotics tend to be constipating. We recommend an over-the-counter stool softener or laxative to prevent that constipation. Also remember, always take your pain medication with food, as it does upset your stomach. Before you go home, you will either be provided with a follow-up appointment, or you will be given a number to make a follow-up appointment with your physician. We usually see patients somewhere between 2 to 3 weeks after surgery. Always remember, if you have excessive pain, shortness of breath, or any of your incisions looking red, warm, or draining any fluid that is abnormal, please give us a call. We are always available to answer any questions or any concerns. Once again, we hope your recovery is well. Please give us a call if there's anything that we can do for you.